Hey guys, it's Abaid from Clear Canal Clinic. I've got another earwax removal video for you guys today. Now this earwax removal is not so much of an earwax removal, it's actually more of a dry skin removal from the ear canal. This patient has a background of ear eczema and also wears hearing aids, so they felt some irritation in their ear and they felt that their hearing was a bit, not abnormal, I suppose. This was their right ear, which they reported was their worst ear. Now you could see there was a little bit of wet wax at the forefront of the ear. They said they had been using some olive oil drops. But as you can see, and I haven't really focused it just yet, but yeah, here now you can see there's not actually an earwax blockage, but there's a thick layer of dry skin and earwax and keratin built up in the ear canal here. Now, ear eczema is usually triggered, just like normal eczema, by a variety of things such as allergies, irritation from products, whether that's cleaning products or earbuds, hearing aids such as what this patient uses, and other triggers as well, like cold weather or humidity. Same as eczema that you'd get anywhere else on the body, to be honest. Now, there's a bit of a connection between earwax and eczema. People with ear eczema often produce less natural oil, which means drier wax and flaky skin buildup within the ear. Sometimes those flakes mix with the wax, creating blockages and that itchy feeling in the ear and that feeling of having a full ear. And these patients tend to be higher risk for having ear infections as well, such as otitis externa. In terms of preventing and taking care of ears, if you do struggle with earwax ear canal eczema is avoid using cotton swabs because they're just going to irritate the skin more and push any wax that you do have even deeper. Use a few drops of olive oil keep your ears nice and moisturized. Now you can see we've peeled off quite a bit of the dry skin and we've tried to suck it up. We're still going in with a microsuction here, trying to get as much of it as possible. But you can see I keep pulling away, and that's because the suction keeps doing what we call clarinetting, and that's making a high-pitched squeaking noise in the patient's ear. This can be quite uncomfortable. You can imagine having something screaming inside of your ear. It's not very nice at all. So you can see that we've got it sort of peeled up, and I think in a moment, so at this point I'm just mopping up some other earwax at the entrance of the ear canal, but you'll see in a moment that I go in with some forceps to try and peel this off in one big lump. So guys, removals like this are probably harder than removing full-on earwax blockages because the way that the dry skin is adhering to the ear canal makes it quite difficult to get to its suction, because that's mainly because of the way that the suction tube is formed, where with a blockage you can put the main bit of the suction onto the earwax. With these sort of dry skin peels, sometimes you're sort of poking and prodding at the ear canal to try and get a nice chunk of it to try and peel off, but unfortunately, because of how sensitive the ear canal is, that can cause a bit of irritation, because while it's not necessarily sharp within the ear canal, because of how sensitive the skin there is, it will feel a bit sharp and can be irritating to some people. I think here now you're going to see the forceps coming out. Yep, there they are. First try, didn't really get enough depth on it, I just completely missed, but got the depth perception all sorted now, and I think we're going to get a good grip on this one, even though I don't think we pull it all out at once. Maybe we do, I don't really remember, to be honest. Sorry for the poor camera work there. Yeah, we got a little chunk of it there, but significant bulk of it is still there. Going back in again with the forceps. Forceps are a great tool for things like this because they're, as I was saying, a lot less irritating once you've got a lot of the skin up, and there you go, that's a big old pull. And there you can see a lot of the ear is actually a lot more clearer, just a bit more mopping up to do now. Another nice little earwax peel coming up. Yeah, there's a lot of dry, dead skin or keratin in this ear, primarily because of the patient's background of ear eczema. You can see most of the ear is actually cleared now. There is still stuff right at the back, but unfortunately I don't think we remove all of that because it's quite closely adhered to the eardrum actually, and it wouldn't be safe poking and prodding that little bit of wax / skin. Just, you don't want to risk rupturing the eardrum, which will cause more problems than benefit for the patient. So I just want to apologize in advance as well, because I didn't really end up taking a picture of what we did remove, because we did have to move on to the patient's other ear, and I completely forgot, as her other ear was quite difficult and very bendy, unfortunately. So about another minute or so of mopping up left. Not too much going on really. Just wanted to say, guys, if you are in sort of London or the Essex area, or willing to travel down towards Romford, please do let us know if you're interested in getting your earwax removed. We do offer probably the most competitive price in the UK at £50 for both ears. I highly doubt you'll find that sort of price elsewhere, so please do pop us an email or a text message, or just book directly if you feel. But yeah, hope you guys are enjoying these videos. We'll try to get a lot more out to you in the near future. Take care, guys, and enjoy the rest of the video.